Orthopedics, the foot. It's sometimes said that the foot is the seat of the soul. Well, foot surgery is hard. If you have a bad result with hand surgery, you can always put your hand in your pocket. But with the foot, if you have a painful foot following surgery, you still got to get around. It can be very hard to deal with. Here's a patient with previous bunion surgery, distal metatarsal osteotomy, now has windswept deformity of all toes. Well, you can redo the metatarsal, but I'm not so sure which surgery would work for toes 2 to 5. Here's a man, a 46-year-old man who had talipes TEB corrected as a child, now has a plano-valgus rigid foot, hind foot. It's also got a lot of, it's got pains confirmed by bone scan, hot over the talo-navicular joint. The CT actually showed that the ankle and the subtalar and midfoot joints were preserved. So what would you do? Whether you do a limited fusion here of the navicular, talo-navicular joint, but I don't think that'll be enough. We'll have to do some distal, have to do some procedure over the lateral aspect of the foot, probably in the vicinity of the triple arthrodesis. 75-year-old female OA cuneiform of the navicular cuneiform, maybe just do a limited fusion. Next case is a 33-year-old OA of the ankle. I'd just do a distal wedge of the distal tibia, just take off this exuberant osteophyte here in the lower anterior tibia, the overhanging tibia osteophyte. Case 5, first presentation, gout, 46-year-old male, painful big toe and ankle. Here's another case, 57-year-old man, accident 20 years ago, now has OA of the TMT joints, hot bone scan, the region needs a limited fusion in the area. Here's a great case for the residents and registrars. 31-year-old man now presents with a flat foot. What could it be? But you notice scar behind the median malleolus. On further questioning, he tells you he had a glass injury to the ankle as a child, age 4. So what happened is that it's a missed, severed tibialis posterior tendon. Now the foot's collapsed. So what would you do for that? Well, I think he needs a reconstruction and augmentation. Case 8, retrocalcaneal bursitis. Here's a next case, gouty tophus, 40-year-old male. Excise of gouty tophus, it's like toothpaste, exudes everywhere. Difficult to get an all-out wound, is slow to heal. Next case, a heel pathological fracture of the proximal phalanx, enchondroma. It healed by itself. Now we make a decision whether to curette and bone graft it. And finally, a ganglion over the dorsal aspect MTP joint. You can get ganglion everywhere, including in the foot. Just excise a fragment. Hope you find these cases interesting.